Hello, everyone. Welcome. Today is June 16th, 2023. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen to find out how pharmacists and pharmacy students like me can improve public health population, health equity, and patient care through advocacy and education. My name is Lucas Nicolau, and I'm a final year pharmacy student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the URI College of Pharmacy, and I'm the academic collaborations officer at the Rhode Island Department of Health. The opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
So today we have a jam-packed day learning about access to harm and risk reduction materials and education in community pharmacies. From today's talk, you can expect to learn things about the legal, behavioral, and logistical barriers that patients and people face to obtain sterile, non-prescription syringes from pharmacies, as well as ways that healthcare providers and especially pharmacists can help. These are including person-centered language, getting harm reduction education, and partnerships with health departments and drug user health programs offering safe disposal and advocacy. We are happy today to introduce Dr. T. Stephen Jones, an epidemiologist and a national leader in the prevention of HIV, viral hepatitis, and drug overdose among people who use drugs. He not only held various director positions for the CDC, but he was also an advocate or an active participant in the World Health Organization smallpox eradication programs in India, Bangladesh, and Somalia. He continues to work as a public health advocate on drug use practice as well as climate issues. So Dr. Jones, thank you so much for taking the time to join us today. Please feel free to introduce yourself and tell us about yourself, your background, and your public health roles and how they intersect with pharmacy.
First of all, thank you for having me on this podcast. I started working on drug user health issues a long time ago in 1987 when the CDC was piloting surveys in various settings to see what the prevalence of HIV was among people. And I selected working in methadone programs. And ever since then, I've had an increasing involvement with issues related to drug user health and have this unfortunate huge knowledge about the stigma, which is of people who use drugs and of people who work with people who use drugs. And it's one of the most difficult things to address, and it is a severe limitation on what options are available to pharmacists, public health people. It shapes the attitudes folks have about what's appropriate to do.
Yeah, I think it's definitely one of the most difficult aspects of pharmacy that a lot of people have to deal with. But I think that definitely bring awareness to it is definitely important moving forward. So a lot of the times when people think of syringes, they think of things like vaccines, hospitals, diabetes, or even potentially people who inject drugs. A significant minority of people have very negative reactions to even the thought of syringes, either for themselves or for others. And from a public health perspective, people may think of syringes in terms of and the importance of proper and safe use to them or of them to avoid the spread of bloodborne infectious diseases such as hepatitis C and HIV and prevention of injection-related harms like skin abscesses, bacterial endocarditis, or even sepsis. Regardless of how syringes are used, using a sterile syringe and needle for each injection and safely disposing the injection equipment is an essential part of the injection process. And community pharmacies and pharmacists have played a role and will continue to play a role for a while now for the convenient access to different equipment, quantities, volumes, sizes of prescribed over-the-counter syringes, access to sterile syringes and needles for safe injection of prescribed medications like insulin or B12, or for the safe injection of illegal drugs to reduce the acquisition or spread of HIV and HCV. So Dr. Jones, you are one of the first and most prominent advocates for community pharmacy access to syringes, even before pharmacists started vaccinating. So why and how did you think that pharmacies would be like the perfect outlet for this public health effort?
You know, it's repeatedly said pharmacists are the best known and trusted by people in the community. So having pharmacists involved and supporting understanding the importance and then supporting the idea that people who inject drugs should have access to sterile syringes was obviously important. The other factor is, there's a pharmacy on every corner of every town. Pharmacies and pharmacists and pharmacy techs are everywhere. So access would be greatly increased if every one of those pharmacies was easy source of getting sterile syringes. And I just want to go back to the 1990s when it was identified that people who injected drugs had a lot of HIV, particularly in the eastern part of the United States. And what the response that some people had is said, well, we should tell drug users to use bleach to disinfect the syringes that they're going to reuse. And there was even a guy in San Francisco who put a plastic bottle over his head and called himself Bleach Man. And one of the things that we did is we said, we need Syringe Man, not Bleach Man. We need to get the idea across that every injection that a person who's injecting drugs does should be done with a new sterile syringe.
Yeah, I think that's extremely important, making sure that patients do have this access to getting safe and clean syringes and needles moving forward. It's been a very difficult effort, I'm sure. I was not a part of pharmacy prior to these few years, but I'm sure that the efforts that were put through have not gone unnoticed, especially with the access that has been put forth thus far. And despite your persistent and prominent advocacy, pharmacists and pharmacy staff unfortunately do have some discrimination towards non-prescription syringe access for people who use drugs, and it is still far too prevalent. Luckily, we have made those large strides in improving the access to syringes through things like policy changes like decriminalization of syringe possession, the removal of quantity limits to syringe sales, and even removal of age and proof of identification barriers in several states. Yet the outbreaks of preventable HIV infections continue to be reported in places that don't have those policy changes in place, as well as some that may. But having the access that we do now has led to that decrease in those bloodborne pathogen transmissions like HIV and hepatitis B and C. This has also provided an outlet for individuals who require the use of syringes to have them provided without having to go to additional healthcare providers. These are all beneficial to the public. However, many barriers still do exist and are still present to this day. So, what can you tell our listeners what still needs to be done to improve and sustain syringes, the access to syringes in both pharmacies and beyond?
I think what we mentioned before, one thing is stigma. One of the most important things I think about dealing with stigma is language. Whenever I hear somebody talk about substance abuse, I talk to them about the fact that how you speak about people who use drugs and the use of illicit drugs is important. It represents how you think about that person. And we need person first, person who injects drugs rather than injection drug user. We need to recognize that people who use drugs are like us. They're deserving of health care and access to the things that they need. So I think that's the first step. And then we have all these other things. We worked with what was then the American Pharmaceutical Association, and I think it's a much better name when it's the pharmacists, and the American Medical Association, the boards of pharmacy, to get out policy statements, joint policy statements saying access to sterile syringes is public health and personal health importance, and we support it. We also worked on the issue of disposal because many pharmacists and many people in the community say, well, if we provide syringes to everybody who needs them, who's injecting drugs, there'll be syringes in every park, kids will be stepping on them, et cetera, et cetera, et cetera. And the issue about safe disposal is another one in which the American Pharmacist Association collaborated with AMA and others in saying safe disposal is important. And we have to have ways in the community that people can safely dispose of the used syringes. And that in particular includes the vast number of people who are injecting insulin. And we tend to forget them. And we tend to forget that they too need easy access to sterile syringes, and they need some way to be able to dispose of them. One of the identified ways to help pharmacists see the importance of selling syringes to people who might use them to inject drugs has been academic detailing. And that's been done in a number of areas. And obviously, when you have somebody who's associated with a school of pharmacy, visiting pharmacists or talking to pharmacists and pharmacy techs about syringe access and the importance of sterile syringes, for a sterile syringe for every injection, that can make a huge difference. And I think that boards of pharmacy are another important actor in all of this. The boards of pharmacies putting out clear policy statements saying we support the selling sterile syringes to people who will use them to inject drugs is another important step.
So I have to have full disclosure in that I designed several federally funded academic detailing syringe access programs that anyone can get free continuing education at respondtoprevent.org. So I've been involved with that. Detailing Dr. Jones, Steve, and I both live in Massachusetts. So I detailed pharmacists and pharmacies in Massachusetts and New Hampshire and Washington State and Oregon as part of our R2P Respond to Prevent program. And it was probably the toughest thing. We were detailing on naloxone access, on the importance of buprenorphine or Suboxone stocking, and syringes. And we actually gave them disposal boxes to give out. And we also had safe injection education that we handed out. So I've been thinking about syringe access a long time. And I'm sure, Steve, you know Jody Rich and all the work that he's done to decriminalize. And 20 years ago, I think it's unfortunate that, we're still talking about these solutions when I believe, Steve, you edited a Journal of the American Pharmacists Association special issue on syringe access in 2002. And yet I'm still almost 20 years later walking into pharmacies or asking my students, do you sell syringes? Does your managers let you sell syringes? And we still face these barriers, even as HIV has declined among people who use drugs. One of the interesting things, I applaud all the issues on language, and language can be taught, I think, through academic detailing. The follow-up on disposal, one of the things we've done in Rhode Island and in New York City and other places is public disposal, because everybody who uses syringes can then dispose of it. Nobody likes bringing a box to a pharmacist to dispose of syringes, even though they're vaccinating and they can. And one of the things that Lucas and I were talking about is you can go into a pharmacy, you can dispose of your old medicine to be incinerated, but you can't dispose of your syringes except in like less than 5% of pharmacies in the country, even though they're selling syringes for all these other things. So what are some solutions to, it's this obvious thing to say, well, I don't want to sell syringes unless there's disposal, but disposal boxes cost money, or they're grant funded, or I'm not used to handing out a box. Or research I did, only 50% of people who bought 10 packs of syringes wanted the box because it labeled them as a drug user. They didn't want to have a bag that had their syringes and a syringe disposal, because where would they go with it? So it's a really interesting thing I'm interested to hear your thoughts on.
I think that when we think about access to sterile syringes for people who inject drugs, I think we always need to include people who inject insulin, because they're of course good folks. They're not illicit drug users, and the problems of being able to obtain sterile syringes and to safely dispose of them apply equally. And I think pharmacists should be providing disposal boxes to people who are buying syringes because they're injected along with insulin. I always try and put those two together, because the tendency is when you think about drug users, you think about all these problems. And if you think about drug users and people living with diabetes who inject insulin, then it becomes much easier conversation. And The problem of disposal is a tough one. Many pharmacists would not like to be accepting syringes, used syringes, in part because of the potential risk for getting a needle stick, and partly because of the same old problem that confronts about selling syringes, and that is that they say that it's risky for us to have people who are injecting drug in the pharmacy, and it may put off all those other good folks who are coming in for diabetes medications, high blood pressure medications, or whatever. So I think boxes in the public where people can deposit syringes is a good idea, but it's not easy. It's not easy. And it's something that we all have to, that health departments and pharmacy boards and pharmacists, state organizations need to look into and find ways to make it easier.
Actually, a student wrote a grant to buy public syringe disposal boxes, and then they found out that it was too close to the federal prohibition of buying syringes at the time. So then we couldn't actually use the money. They loved the idea. They found a different funding mechanism, and we have vending machines, which I know where Lucas is going to ask about for syringes, and we have the disposal next to the vending machine, which to me makes the most sense to have the disposal at the pharmacy where you're buying syringes anyway. Close the loop, right? Realize that we're doing that. And I think that there's a destigmatizing effect, because most of the surveys of pharmacists, and we'll talk about the paper you reviewed, talks about, I don't want to sell because I see those syringes out, like you said. Well, now if you have disposal that you see from your perch in the community pharmacy, maybe you're sort of thinking this in a sort of a closed loop.
I agree. And disposal boxes are a wonderful idea. They have to, however, be serviced. You have to get a company that handles possibly infective waste. So there's a lot of money involved in it. It's not simple.
I definitely agree with it being not simple, because it's come a long way, but it definitely still needs a lot of work to be done. And some of the solutions and some of the themes that kind of went through was all brought up in the paper that you had just recently reviewed that Dr. Weber was talking about earlier. It was titled Attitudes, Beliefs, Knowledge, and Practices for Over-the-Counter Syringe Sales in Community Pharmacies, which was a systematic review. And one of the major themes that came from it is the general support of harm reduction, but even when they have the legal authority to sell non-prescription syringes, they're often unwilling to do so, just due to the stigma either towards the people who use the drugs and syringe sales, or both. So what are some of the short-term and long-term solutions to mitigate these stigmatizing attitudes so that policy changes to improve syringe access can be actualized in practice? I know you had mentioned the language. I know that's a really big part of destigmatizing people, to allow them to have that access to syringes, but what other ways could be used?
That was a review paper, and it looked at various surveys and studies that have been done in the last 20 or more years, in which either people who go into a pharmacy and say, I'd like to buy syringes, or you question pharmacists about their attitudes and what they would do. And I think that this is overgeneralization, but we found over the years that it's about a third, a third, and a third. A third of pharmacists say selling syringes to people who are going to inject heroin or fentanyl or whatever is a great idea. I support it. It's protecting people's health. A third to say, I'm not sure, there's pluses and minuses and so on. And a third say, never. Pharmacist discretion allows pharmacists and pharmacy techs to say, the law says we can sell them, we don't want to, or we're not going to sell them to you. All of the things that we talked about before, the pharmacists speaking up for the importance of providing sterile syringes to people who inject drugs, boards of pharmacy associations, public health agencies in various states. Those are all important ways to shift it maybe to a half or maybe even 2/3 of the pharmacists and pharmacy techs saying selling syringes to somebody who is injecting drugs is a public health important. It's important for that person's health, and I do it willingly. I guess one other thing is we're talking about a lot of syringes, and Peter Lurie and I put a paper in which we used the estimate of how many times a person using heroin would inject to approximately 3 times a day. And we multiplied that times the number of days in the year, and you get about 1,000 injections per year in somebody that's regularly using heroin. Pretty soon you get into millions of syringes required if somebody's going to use a new sterile syringe for every injection. So it's a large number of syringes. And there's another part to that too, and that is that when people are, well, I guess one comment is now fentanyl has a shorter impact time. It's not the right terminology, but
Half-life. Our listeners love half-lives. Yes, half-life.
half-life. So that instead of it being the 3 or so injections per day for heroin, it would now be 4 or 5 injections a day for fentanyl. So the numbers get even larger.
No, it's great. I made a note. I was going to just talk about the fentanyl increasing the number of injections per day, or even some of the prescription opioids, which are modified to injection use, like in Indiana, the HIV outbreak among people who were injecting Opana, were injecting like 10 times a day and didn't have access to syringes under then Governor Mike Pence, and not having syringe service programs. And so that's where pharmacy, I think, we'll talk a little bit about policies, but I just want to bring up one thing that we learned in our study that was important that you mentioned, is that most syringes, and Lucas probably knows this too, are sold by technicians. They're actually not sold by pharmacists. So there's two kind of dynamics in the pharmacy. Is you might have a tech who says, I'm part of that third that says this is great, but the pharmacist is on the other side, and you have to do what the pharmacist says. They won't do it. Or vice versa. The pharmacist is like, we are a harm reduction pharmacy. We reduce risk for the community. And the tech is like, I don't want to do this. You may not know what those interactions, you're not observing every interaction. And so we learned that it's very important to have the whole team on board. And when the team was on board, and I would, go detail these stores and say, hey, what do you know about? And everybody's like, yep, we're all on board. Or there were often people in the middle who said, I'm kind of wishy-washy on this, but my pharmacist supports it, so I do it. So it really, it comes down to every interaction can be potentially beneficial or stigmatizing, but we also learn that you can change those attitudes. And a lot of it comes down to anonymity too. Is one of the innovations we learned in Rhode Island and Massachusetts was drive-through syringe access. Now, yeah, thumbs up. I mean, there's one of my students who co-wrote a paper on a review article on syringe access and harm reduction in pharmacies, is she says, at my drive-through, we give dog biscuits to the people with dogs. Why can't we give syringes? I was like, I didn't know, my colleague, Tracy Green, who Dr. Green and I were like, this is phenomenal. Let's put there's the logistical things that Lucas mentioned. Let's put the syringes by the drive-through. Somebody comes in, you can pull it out, go, this is what you want, take their money, and you're serving a clientele that only has cars. So that's a different level of status, but you're actually doing it in a much more anonymous way, where what some of those papers or some of the people who use drugs that were surveyed said, I don't like going to pharmacies, and they say, yeah, we need to go get syringes, and they run to the back, and this whole crowd of people sees somebody getting a 10-pack of syringes. You're not going to do that experience again. So what do you want to talk a little bit more what you think about drive-through syringe access?
I think it's an absolutely wonderful idea that needs to be publicized, because it removes one of the problems that pharmacists say about selling syringes to people who would be injecting drugs. Those difficult people are not in the store. They're not at the counter. Our patients are not interacting with them. So I think you ought to get that student or whoever who came up with the idea to write it up and get it published and circulate it to as many state pharmacy associations and boards of pharmacy as possible, because it's a brilliant idea. Anyway, I perhaps too strongly endorsing it, but I hadn't heard of this before, and it does have those aspects of making it easier to do that. And I think that paper that I reviewed talked about OTC, over the counter. And that's not really what the situation is with syringes. And we need to be clear that it's the tech or the pharmacist has to get those syringes, maybe yelling back, as you mentioned, to be able to provide them. It isn't that the customer walks by a display of syringes and picks up a 10 pack and goes to pay for them, which is unfortunate. And the same complexity applies to naloxone. That's not going to be over the counter, except for the meaning that a prescription is not required. That's one thing. And I guess I think we're in a more difficult time these days because this fact that 100,000 people died of overdoses in 2022, and fentanyl was such a huge part of it. Around the country, there are these local efforts, sometimes supported by federal agencies, in which people whose son or daughter may have died of a fentanyl overdose have a picture and say, my child was poisoned, and we need to punish more years in jail for fentanyl, drug-induced homicide laws, so that if I provided fentanyl to someone who then died, I could be tried for murder. And I want to take my non-existent hat off to the American Pharmacists Association and to you, Jeff, because you got the National Organization of Pharmacists to say support, don't punish. And we need to shout that from the rooftops, because now everybody's so worried about fentanyl that they are saying, well, we need to throw people in jail for another 10 years if they have so many grams of fentanyl in their possession. Punishment is not going to stop fentanyl overdose deaths. It's not going to stop it. It may even make it worse because people will hide what they're doing, inject alone. So I think this is a hard time for harm reduction in the United States. Harm reduction is getting slammed. Some people say, oh, it's not working, and we need to reject the idea of syringe access programs, syringe exchange programs, et cetera.
Yeah, I completely agree. I think that it is so difficult to get that point across to some people. And it's just like we just got to keep on letting them know that harm reduction strategies are working and they are saving lives day in and day out. I think that I had saw something on Twitter mentioning a county in California saying that they were just going to start arresting people for having illicit substances on them again, quote, getting back to the basics, which is not the right thing to be doing at this time. It should be promoting the harm reduction strategies that should be or that are occurring in other states and trying to promote them in the state of California as well. You had mentioned earlier with the drive-through syringe sale, which is an amazing point and should be brought up in multiple different pharmacies in multiple different states. And it would be great to have syringes in other places as well. One increasingly popular harm reduction innovation is the harm reduction vending machines. And those provide anonymous and free access to drug checking equipment like syringes and needles with fentanyl test strips as well, and safer sex supplies, naloxone, non-prescription syringes like I had mentioned, and other items as well. So how do we optimize the use of these machines, and where else would we want to put these types of machines or other places to include syringes in general to be sold outside of a pharmacy?
I think the idea of vending machines is a wonderful one. It makes a sort of public statement when you see a machine that it has naloxone, Narcan, syringes, whatever in it, that these are legitimate products that should be available to everyone. I think that one of the big drawbacks is those machines are expensive. Tens of thousands of dollars, I think, for real vending machines, as opposed to something where the product is, you just reach in and get the product. So it's a wonderful idea. It's a great public statement, but it's hard to implement those on a huge scale. I know some areas people are using the opioid overdose payments to buy those machines, and that's a good use for them. But I think we can't meet the need with vending machines. And I want to say also that there's a variety of laws that exist that criminalize possession of syringes as opposed to just drugs. And there are places like this great state, the Commonwealth of Pennsylvania, where syringe access, syringe exchange programs have never been approved. So there are local and state barriers. And my understanding is that the state of Washington has recently considered and possibly reimposed possession of syringes as a crime if you're going to use them for injection of drugs. So we need to work everywhere to get people to understand the importance of access to syringes, access to naloxone, a public health approach. And I would say one of the things for me about harm reduction is not syringe exchange. Harm reduction is believing that people who use drugs are like us. They're real human beings. They deserve compassion and respect. That's to me is an important part of it, because that in some ways addresses the stigma that those people feel and the self-imposed stigma where they think of themselves as less wonderful, less respectful than other people.
I completely agree. I think that the whole role of harm reduction should be to make it so that way you are just an individual. It doesn't matter what disease state you have. It doesn't matter what you do. It is what you are as a person, and to make sure that the person is what's being heard and not the disease state that's being heard over that. I think that a lot of people get lost in like, okay, you have this disease state, I'm treating you like anybody else that has this disease state, when they don't put into perspective the rest of the human side of things, which I think is really important to take away from all of this, is that making sure to treat the person, not treat the disease state.
And, the stigma applies to more than just people who inject drugs. People who are heavy, overweight, people who have diabetes, all of them struggle with societal stigma.
Yeah, fully agree. Patient-centered care, harm reduction, risk reduction. I mean, I always say that pharmacists are harm reductionists. We are the last, as sometimes say, the last, but we're the last line for, it's sort of like, well, I don't, this theme of who comes in the store, and it's those people. And when I talk to those people, as I know you have, and they're like, I heard this pharmacist refusing some prescription to the person in front of me, and I injected 4 times that day. But because I'm wearing a clean t-shirt, nobody knows who I am. So it goes, it's poverty stigma. It's so many overlapping things. We could have a whole podcast on systemic racism, which also interferes, and our drug laws are racist. I'm going to keep saying that until I can't breathe, because they are. And so, we just talked this morning about passing pharmacy laws to expand access to pre-exposure prophylaxis and birth control and contraceptives to people who are stigmatized and minoritized and don't have money and need access to care, whether it's syringes or meds or preventative meds or vending machines. We need all access to give people what they need. And I think another point I want to emphasize is having the people with lived experience, as we call them, or people who use drugs, help with the policy. We have to hear from them, because people who use drugs aren't policymakers, fortunately, as far as we know, right? They don't identify as such. And so I think it's really important that we take all those concepts to really kind of anything, whether it's diabetes care, whether it's specialty med access. Let's talk to the people. And the role of government and the role of policy is to expand access, not to restrict it. Even as we advance access to drug paraphernalia like fentanyl test strips, I hear these horrifying things. One of the most progressive public health states, Washington, taking steps back on syringe access is horrifying. And so, the regimen for syringe access starts with advocacy and listening to the pod, and hopefully folks will figure out how they can change the law. But let's have Lucas take us out here.
I just want to say one thing, and that is the pharmacists can shout about support, don't punish. Getting that word out to state pharmacy associations and state boards of health would be hugely helpful and be a step towards dealing with this rollback of harm reduction approaches.
Yeah, definitely agree. I think that that is really the main regimen here. Speaking that as a pharmacist, as a technician, making sure that education goes alongside with pharmacists for destigmatization as well as the technicians, because like Dr. Bradberg and you, Dr. Jones, has said that majority of people who get those syringes are going to be from technicians. And if the technicians don't want to do it, then there's a barrier of care right then and there. If the pharmacist would like to, but the technicians don't, majority of sales will not be done for that. So I think that's also an important point to make, as well as improving those accesses from allowing syringes to be sold at those drive-throughs to having those vending machines as well. So this really has been a great discussion today. And I'd like to thank you, Dr. Jones, for being here today and sharing your expertise with us on this topic.
It's been an honor for me to participate with you guys, and I hope it's been useful.
Yes, be sure to follow us at PharmD Pub Health on Twitter and Instagram. Turn on post notifications so you never miss an episode, and smash that subscribe button now on Spotify, Apple Podcasts, our YouTube channel, Amazon Music, or wherever you listen to podcasts.